How you know if you're ready to travel. So you're a nurse and you're looking to get that coin like the rest of us, and you're looking at travel nursing and thinking, why don't I give that a try? But are you ready? Let's talk about it. So my background, I started off in a combined pediatric ICU. We had cardiac, neuro, trauma, burn, surgical ICU all in one. I waited about 4 years before I started to travel, but that doesn't mean that that's the minimum. That was just my experience. However, I will say that as tempting as it is to jump into the travel nursing pool and start making that money, we all want to, it is really important to kind of stop and think, like, do you have the clinical skill set and the confidence to jump into a new environment every few weeks and be able to take care of high acuity patients? The truth of the matter is, when you start a traveling assignment, you might have 1, 2, max 3 days of orientation. So when you hit that unit, you have to be 100% rock solid in your clinical skill set so that you have the capacity to learn everything else around you. I'm talking about a new charting system, a whole new team of clinical workers, how the equipment works. Maybe it's equipment that you're not familiar with, new monitors, new protocols, where things are, supplies in general is really time consuming. Being a traveler in an ICU specialty requires a solid foundation and prioritization. You have to know how to prioritize because you're learning everything at once. So you need to know, what do I need to focus on first? Patient safety, obviously. So you need to know how, the equipment functions, how the monitors are connected to your phone, alarms. If I have a code, which button do I press? Things like that seems so obvious. But again, it's a lot to learn at one time. Then you have to figure out, okay, what are the protocols that this hospital really focuses on? The things that they evaluate and use metrics to kind of determine like where they are in standards of care. So, CLABSI protocols and CAUTI protocols, and how do they give blood, and all of those things are really important to get to know right when you get on an assignment. Then as time progresses, you can start focusing on all the smaller potatoes. Like, okay, how do you guys chart this and chart that? And do you chart your cares and yada yada? None of that stuff is going to save your patient's life. But as you can see, it's a lot at once. And when you think about it, starting a new job is like one of the single most stressors for people in general. Add on to that you're working in an ICU specialty and people's lives are on the line. So you can see this is a lot to take in at one time. You really don't have the mental capacity to try to be still finessing your clinical skill set. So my recommendation, and I can really only speak for ICU specialties, wait until at least 2 years, please. Because if you don't, the money will not be worth the stress. And you're not only putting patients at risk at that point because you're trying to juggle too much, but you're putting yourself at risk in that degree that you work so hard for. Recently, I was working at a hospital. They had hired a traveler. She seemed very kind of rocky in her skill set, was asking questions that, nurses that have worked a year less should know, how to prime, like primary tubing, things like that, things that you don't have time to stop and ask in an ICU specialty because there's just too much going on. And come to find out, she was a brand new nurse, and it's like, girl, I understand your drive, I appreciate it, but this is not helping you, it's not helping everyone else, and you're really just putting yourself at risk. So bottom line, I think when you know you're ready is when you feel like you could teach someone. Someone could tag along for your whole shift and you'd be able to explain the rationale for everything. That doesn't mean that you're not going to have questions. Everyone has questions. I have questions after 10 years. That's normal. You work in a wide-ranging specialty. Sometimes you see something once and not again for the rest of your career. So that's natural. But you need to be absolutely confident in your skill set because you will need to fall back on it. That being said, I hope everyone gives traveling a shot. It is life-changing. It was one of the best decisions that I made in nursing, and I think honestly it made me a stronger nurse.